Hello and welcome to my channel. This is Isaac Simple. Welcome to my channel. In my YouTube, it's Mkurugenzi Maish. Facebook, Mkurugenzi Maish. TikTok, Mkurugenzi Maish. Welcome to my channel. Kindly do not forget to like, subscribe, and share, and more people be able to be enlightened about this channel. This is where we focus more on averting HIV stigma in our society. And also we say that being positive about HIV is not necessarily being HIV positive. Thank you. Thank you even for subscribing to my channel. Kindly do not forget to like, subscribe, and share to my channel. Welcome. Today we will not be able to discuss HIV today, but rather an emerging issue that I've seen, especially in our practice. There has been arising incidences of snake bites in the societies, especially in this heavy rain season. I think because of this downpour of rains, the snakes have moved, especially from the bushes, and they are now closer to our homes, especially because of the thickets that have outgrown because of the heavy rains that is pouring in our country. And now, I think it's very important for us to learn about a snake bite and how we should be able to handle a case of a snake bite. This topic is a first aid or emergency care in case of a snake bite. Welcome. Kindly do not forget to like, subscribe, and share, and also be able to inform others so that they can be able to learn more about, in case an eventuality of a snake bite occurs to them, what they should be able to do. Thank you. To begin with, let me be able to try and explain more about that there are several species of snakes, and some of them are poisonous and others are non-poisonous. Especially in our country, Kenya, the most common poisonous snake that we know is cobra snake. And cobra snake, they are very common, especially in semi-arid areas, and they are dangerous. And some people have been bitten by cobras. Others, they have been bitten, especially rattlesnake. Those who usually work, especially in quarries and rock areas, rattlesnake usually love those kind of areas. And these cases are increasing day by day. And it's very important so that we can be able to learn and know what should we do in case I've been bitten, in case you have been bitten, in case your friend has been bitten. What should you do? Now, before we go to the do's in case of a snake bite, let us start with the don'ts, because these are the kind of the dangerous and grievous mistakes that we do in case someone has been bitten by a snake. One, do not attempt to trap the snake, or do not pursue the snake or pick it up so that you can carry with it to the health facility. It is not very necessary, because you may cause more harm than good, and also you'll be wasting a lot of time that can be utilized to rush this person to a healthcare facility. The other thing, do not wait for the symptoms to start manifesting so that you can be able to rush to a health facility. So, especially because some poisons take time, others are very fast, and this depends even the site, the amount of venom that has been inoculated in your body, and this appears different to different people. So You may ignore it and think that it was not poisonous, yet after some time, it becomes fatal on your side. The other thing, and this one I'll say it, I don't know, I'll say it in capital letters or in bold letters: never tourniquet a snake bite. When you do a tourniquet, what do I mean with tourniquet? Maybe I'm using a very unknown English. Tourniquet is like, let's take like this piece of cloth. When you take this piece of cloth, and then let's make an assumption that my bite is either here and here. We are taking these two marks as the sites where I've been bitten. If I take this kind of cloth and then I tie here tightly and very firmly, that I obstruct arterial, venous, and lymphatic flow, I have already tourniqueted. And this is very fatal. What will happen on this part? Okay, to begin with, you have affected the venous return. What will happen? The swelling and sores. Second thing, you have blocked the arterial blood flow. What will happen? Ischemia will settle in. The other thing, there was a bite and there is inflammation. What will happen? The inflammation or the pain will be aggravated. So we will be killing this distal part of our hand out of our ignorance. So avoid and never ever tourniquet a snake bite. What are the other things? The other thing, do not attempt to suck the venom out of the bite site. While doing so, you may not be helping yourself. First thing, when you're sucking it with your mouth, you are causing contamination to your mouth. The other thing, do not apply ice or maybe immerse the wood in water. It will not clean up the venom that has already been inoculated in your blood vessels. You can clean it outside with water and soap, but immersing it will not suck in the venom that has already been inoculated in your blood system. So it may not be of much help. The other thing, do not attempt to take painkillers, because some painkillers are blood thinners, and some venoms they cause they also cause blood thinning. So you may cause severe hemorrhage by especially maybe using aspirin. But the best thing, just okay. The other thing, before I go to what you should do, do not drive yourself. Even if you had your own car, let another person be able to drive you to a health facility, because some of these venoms, they may cause you to get to maybe septic shock, and you may not be in a good position, or maybe cardiogenic shock, and you may not be in a good position to drive yourself to the health facility. You may cause accident on your way. So those are some of the don'ts. I've just highlighted just but a few, but there are so many don'ts which you can research more and be able to know them. The other thing I'll talk about is about what are the do's. If possible, maybe you can take a photograph of the snake. It will create a picture, especially while looking for the best anti-venom for you by a healthcare worker. But if it's not possible, it's not necessary. The other thing, try and keep calm. And also, if you are the person who is taking care of person who has been bitten by a snake. Try to reassure them, try to give them hope, especially if the pain is very severe. Try to reassure them that they are going to get help at the healthcare facility. The other thing, inform a chaperone or supervisor or a colleague so that they can be able to offer a hand in case it is necessary. Now, what are the do's that you should do in case maybe your colleague or your friend or your family member has been bitten by a snake? Now, after you have calmed them down, let them sit down or lie in a neutral position and their position of comfort. In case they have a wristwatch or maybe a ring, remove the rings, wristwatches, or any other jewelry from the hand or from the feet in case it's a feet bite or a hand bite. Why do we remove them? This is because in case of a snake bite, we are expecting swelling, and if the swelling becomes severe, you'll not be in a position to remove this kind of jewelry from your wrist or maybe from your finger, and this may cause a tourniquet on the hand of the patient. The other thing, do not, don't, but try and wash the site with soap and water, and also cover it with a clean cloth or a clean bandage, and do not tighten it. The main purpose of doing this first is to arrest the bleeding if there is bleeding. The other thing is to be able to prevent lymphatic flow, because the bite is superficial. So when you are preventing lymphatic blood flow, you are slowing or you are reducing the rate of the penetration of the venom into the body system, the whole body system, or to the heart, towards the heart. So this one is only to block the lymphatic flow, but not the arterial blood flow. So it is usually covered in a way such that one finger can be able to be let in after you have tied or you have covered the wound. Again, it should be a bit firm so that you can be able to arrest the bleeding in case of a severe bleeding. So that's it. The other thing I want to talk about is you should also mark the edge or the leading edge of tenderness or swelling. That is, for example, as I said earlier, let's assume these are my bite marks, and the swelling has reached to this point. This is the point that I'm going to mark. In case the swelling has reached to this point, you just mark it and write time. When you write time, this will help to be able to calculate even the rate at which the swelling is getting, and this one can be of help, especially when planning on your management, even at the health facility. Now, what happens at the health facility when you get your patient at the health facility? They usually do the primary survey and then the secondary survey, and they are able to counter the effects that have already arisen. In case the patient is unable to breathe, they can be assisted. In case the antivenom is available, they are going to get it on time. And the others are just monitoring the patient and offering the optimal care that they need to be able to be saved. And by doing this, you'll be saving a life, and you'll be helping your community, and also you'll be enlightening your community practically on how they can be able to solve such a problem. Thank you for watching my channel, and God bless you. Kindly like, subscribe, and share, and let more people be able to learn more about this channel. Thank you and goodbye.